My name is Janay Gomez. I've been with the agency since 2013, so coming up on 10 years. I'm currently the Assistant Director of Nursing, and I'm also a board certified family nurse practitioner. I didn't initially start with Seneca as my nursing career. I started at Mark Zuckerberg, actually, in the city, so San Francisco General Hospital, in labor and delivery as a nurse there. I really enjoyed working with like perinatal folks, supporting families as they transition into parenthood. It really gave me my passion for pediatrics. Well, there's so much that nurses do at Seneca. I don't know if I have enough time to tell you everything. Specifically for nurses at Seneca, there's a variety of things that you can do. So I know typically you think of Seneca as being sort of like mental health, pediatrics, but it's also that touch of like public and community health, which is really exciting. Our nurses, they sort of sit at the intersection between pediatrics and mental health for sure, but there's space to innovate, come up with different project designs. There's a way for you to see a need and be able to think about and work with your team to meet that need. So you have a lot more autonomy than you would experience in like most sort of like inpatient or institutionalized settings as well. So our nurses work in a variety of settings, including crisis stabilization. We have an amazing Ventura crisis stabilization unit down in Southern California, which supports youth that are literally in crisis, that are experiencing huge behavioral, emotional things going on in their families, personally, at school, in their relationships, and they just need that support right there in the moment. So our nurses there do a variety of things. They do intake assessments, so that's your head to toe physicals, making sure that the youth are physically stable to be in program. They also reconcile medications, so making sure that youth are receiving the medications that they should have to keep them physically stable, and then just meeting any sort of healthcare, sort of medical triage needs that might come up. We also have our STEP partial hospitalization program, which we call our subacute programs. And that's a specific partnership with Kaiser Permanente. We have youth that are basically have been in a state of escalation or crisis that are now sort of trying to transition back into their homes from maybe inpatient, following a potential suicide attempt, things like that, exacerbations of depression, anxiety, all those big feelings and things going on in their lives. The nurses there do something very similar to a crisis stabilization unit nurses where they do intake assessments. They communicate with families about the program, tell the families what they're going to learn, what to expect. But then they also support with like medication management and program. We also have youth that have a variety of chronic healthcare needs like asthma, diabetes, other things like that. So our nurses provide support, education, medication management there, as well as education to our teams or our non-medical staff so they're able to support the youth in program. We also have an amazing non-public school nursing team. So they do sort of your traditional school nursing support, but in a different setting than you would see sort of like in a mainstream school setting, because these youth are specifically referred to our non-public schools because of various behaviors that they have that aren't easily managed in those mainstream settings. So our nurses provide a little bit of an extra level of compassionate care because they recognize that these students have additional needs beyond the regular sort of student that you would see in a mainstream program. The way our nurses do that is with tons of empathy, with the skills that they learn, through trainings at Seneca, and also just with their heart for the specific population. There are so many reasons for nurses to choose to work at Seneca. There are plenty of opportunities for growth. I am an example of that. I came in as a registered nurse, a BSN, a trained nurse, and was supported in going back to school by my director of nursing, going back and getting my master's in nursing and then becoming a family nurse practitioner. I'm now able to work under my scope as a family nurse practitioner. So basically providing support to youth at a provider level, which is really exciting. Seneca supports us with scholarships. They support us with flexibility as far as schedules. I have to say that it is a specific calling that nurses have to mental health. The folks that come to Seneca, they are called here. They're interested in the population. They want to serve the population. They want to do more. They're specifically interested in working with an organization that is making an impact in various communities at a real grassroots level. So a real meet you where you're at sort of level. So I feel like the nurses that are at Seneca are just like any other nurse anywhere else. It's just, it's our passion is mental health. Our passion is this specific population. So that's what we're called to, and that's how we end up here. What I love about working at Seneca is the fact that nurses get to work so closely with our interdisciplinary teams, so our educators, our clinicians, our leadership folks. We all rely on each other, right? We all hold a specific piece to the puzzle and meeting the needs for the family. At Seneca, we're really focused on mental health, but physical health is always sort of underlying. It's always there. It's always current. What I love about Seneca is that they recognize the whole person. They recognize that, work isn't everything, right? There is a balance. They help you to hold those boundaries. And, this work can be really challenging. Some of the stories, the interactions that we have, I mean, it's all for a good cause, but ultimately we're human beings. And one thing that, our leadership folks and everyone at Seneca recognize is that it's important for us to prioritize ourselves and take care of ourselves. I love that support of having a life and taking care of yourself and not having your life just be all about work. Yeah, if someone wanted to become a nurse at Seneca, whether at a registered nurse level or even at a psychiatric nurse practitioner level, it would be best for you to follow us on social media or go to senecafoa.org.